Hi everyone, Dr. Faver here with Teaching Moments. This is just kind of a quick little tidbit. A lot of groomers say that, it's hard to get people to do therapies on that. But one thing I found interesting, this is a stat from the veterinarians, that 70% of the clients would prefer not to use steroids or things like Apoquil and that. 70% of them would prefer not to use those kind of drugs. Then what we have to offer should be very enticing to them. The hard part I think we run into is how do we talk to them? How do we discuss that? And one of the hardest things I think it is anything on the skin and skin related, we put such a low emphasis on in veterinary medicine. And as clients, the same thing. We put such a low emphasis on it that we just don't prioritize having to go through a little bit more involved process to get results on that. We want the quick fix, and that's where steroids and that become very popular. And, I did chiropractic medicine, and it was no difference. If I had to have a client come in, 4 or 5 times to get the back adjusted versus they could get a shot of cortisone and it would go away. They say they didn't want the cortisone, but they'd take the cortisone a lot of time. But don't give up, because truly at the bottom of their hearts, they don't like the cortisone. They don't like the Apoquil. They're not using the chlorhexidine most of the time to start with. And the antibiotics, we've got problems with that. So, I think it's important that we get passionate about the fact that we can help these dogs and we're not using all those drugs. That's really the glory of what we do, and we get better results. So hope that helps. We'll see you next week.